Hi guys, welcome to another video. And in today's video, I am going to be talking about the weight loss medications, and some of the popular brands which have been buzzing around of late is Ozempic and Mounjaro. So everyone, literally your influencers, celebrities, your neighbors are talking about these weight loss injections. Okay, people are just dropping 15, maybe 20 kgs over a year and calling it a miracle injection. But here's what nobody is actually explaining. What are these drugs and what are they doing inside your body? And more importantly, as a dermatologist, why am I talking about these drugs? So in this video, I am going to try and cover everything, the science, the benefits, the risks associated with these medications. So stick with me until the end of this video. So like I said, there are two big players in the market right now, in India especially, which are dominating the conversation right now. The first is Ozempic, which actually is a drug called Semaglutide. And the second is Mounjaro, which actually contains a drug, Tirzepatide. They are kind of related, but not entirely. And this difference matters a lot. Let me explain. So to understand these drugs, you need to know about a hormone called glucagon-like peptide 1. So every time you eat any meal, your intestine actually releases this glucagon-like peptide 1. From now on, I'm going to be referring to it as GLP-1. So once GLP-1 is released into your bloodstream, it's a part of a group called incretins. So these incretin hormones are what manage the blood sugar levels and your appetite. So here's what GLP-1 does. In a few minutes after your meal, it tells your pancreas to release insulin. Now what insulin does is that it lowers your blood sugar levels. And it also tells your pancreas to stop releasing glucagon. Now glucagon is a hormone that would otherwise raise the blood sugar levels. So in this way you can see that it eventually lowers your blood sugar levels. Second, it slows down your stomach emptying time. So you end up feeling fuller longer. And crucially, it signals your brain to say you're satisfied now, stop eating. Now here's the catch. The natural GLP-1 only survives in your body for hardly 2 to 3 minutes. That's it. Then our enzymes start breaking it down. So what researchers did is that they engineered a drug. They changed 6 peptides in the chain and therefore made a version of GLP-1 that lasts much longer. Hence, this is called as a GLP-1 agonist or semaglutide. It's just a modified GLP-1 molecule that is engineered to resist this breakdown. And it stays active in your body for much longer, for say approximately a week. This is why Ozempic, which is semaglutide, is a once weekly injection. Let's understand Mounjaro. Mounjaro actually takes it a step further. Now Mounjaro's active ingredient, like we said, is tirzepatide. It does something a little more sophisticated. It actually activates 2 hormones. That's why it's called a dual agonist. So along with GLP-1, similar to Ozempic, it also acts on something that we call GIP, which is glucose-dependent insulinotropic polypeptide. Now, GIP is another incretin hormone that works in a slightly different way. Together, this dual action gives tirzepatide a stronger effect on the appetite suppression as well as the metabolic regulation. So if semaglutide, which is marketed as Ozempic or Wegovy, can drop 10 to 15% of your weight, tirzepatide, which is Mounjaro, can drop 15 to 22% of your weight. Now, this is what studies have shown. In the SURMOUNT-1 trial, patients on the highest dose of tirzepatide, which is 15 mg, lost an average of 22.5% of their initial body weight, numbers that were previously seen only with bariatric surgery. That's why these drugs are called miracle drugs, because now you don't have to go through a strenuous surgery to achieve this kind of weight loss. So initially, when these drugs were launched, they were actually only approved for type 2 diabetes. But semaglutide was later even approved specifically for obesity. Now this is marketed under the brand name of Wegovy at a higher dose than Ozempic. So Ozempic is usually limited to a dose of 1 mg, whereas Wegovy is also available up to 2.4 mg. Now, as a doctor, I would be prescribing these drugs to you if you have a BMI of more than 30, which is you are obese, or if you have a BMI of more than 27 with one weight-related condition, such as hypertension, sleep apnea, Polycystic Ovary Syndrome, diabetes, etc. These drugs are an absolute no-go for people who have a personal or family history of medullary thyroid carcinoma and multiple endocrine neoplasia, which is MEN type 2. Also, these are not recommended if you're pregnant or lactating. Now, let's talk side effects. What most people experience because of these drugs due to a slowed down gastric emptying is common GI-related effects such as nausea, vomiting, bloating, constipation, diarrhea, and an acid reflux. Now, the good news here is these side effects are only temporary. They may last for 2 to 3 days after the injection. Also, as time passes, suppose you've taken 2-3 months of the injection, these side effects actually end up decreasing quite a lot. There are also dose-related side effects. So at a lower dose, you may not get these side effects at all. This is actually one of the reasons why these injections are started at a low dose and then titrated up slowly. For example, if we take semaglutide, it is started at a dose of 0.25 mg, and then every 4 weeks, we increase the dose to 0.5 mg, 0.75 mg, 1 mg, and then 2.4 mg. Now, the rarer but more serious side effects include pancreatitis, which is inflammation of your pancreas. Second is gallstones. Rapid weight loss actually increases the risk of gallstone. Third is severe dehydration. especially if you have the side effect of vomiting, which is very significant. You may have dehydration. Next is kidney stress. Usually this is secondary to dehydration. Then comes thyroid tumors. So when they were doing animal studies in rodents, they actually saw that there's a slightly increased chance of developing thyroid tumors. And that's why a very strong family history or personal history of medullary thyroid carcinoma is an absolute contraindication for these drugs. Now, we all know that these medications do cause weight loss. But along with your fat weight loss, there's also a lean muscle mass which is getting lost. Now, research suggests that up to 30 to 40% of the weight loss on GLP-1 medications may actually be lean muscle mass and not just fat. This is not only unique to Ozempic, but it happens with any significant calorie restriction. That is when you're dropping weight, you're dropping fat as well as lean muscle mass. This can be a little concerning because loss of muscle mass means that you have reduced strength and reduced physical function, a slow metabolism, making weight maintenance harder, and from a cosmetic standpoint, a deflated look people may notice. You may also get nutritional deficiencies. In general, when people eat significantly less, they can develop deficiencies in protein, iron, vitamin B12, and other micronutrients. Now, this needs active monitoring. Now, this is perhaps the most important conversation to have. Clinical data shows that many patients regain a significant proportion of lost weight within a year of stopping these medications. In addition, we cannot only depend on these injections for weight loss. It's a must that we have a nutritional balance, we exercise, and also holistically have a lifestyle change and are not only dependent on the injections for weight loss. As a dermatologist, many people ask me this new term which has been floating around called Ozempic face. Now, it may sound trivial, but the changes are genuinely significant. And the changes include hollow, sunken cheeks, deepened nasolabial folds, as well as sunken, tired-looking eyes, sagging skin along the jawline and neck. Another question commonly asked is, since it's being called Ozempic face, does the side effect not occur with mounjaro? This actually completely false because the chances of these older-looking faces is more likely with mounjaro, since the fat loss is more with mounjaro than Ozempic. So remember, this change is likely with both the medications. Why this happens is your face has a complex system of fat compartments. These are pockets of subcutaneous fat that give your face a youthful volume and structure. With rapid weight loss, these fat pads deflate quickly. But here's the key thing to understand. Your skin cannot shrink at the same rate. So skin elasticity, especially in patients over 35, simply can't keep pace. So you're left with a volume loss. It's the same process that is happening in your face that happens across your body. So your butt may appear flatter, your arms, your thighs may have loose hanging skin, the abdomen skin may not retract after significant weight loss. Since muscle mass is also getting lost alongside fat, the result isn't a toned, fit look that many people expect. It can look more soft and a deflated look, a smaller version of the same body rather than a transformed one. This is why I would recommend a good diet, which is adequate proteins and resistance and weight training along with these weight loss medications. If the facial changes have already occurred, what I would suggest is we can fix that with dermal fillers, such as with a hyaluronic acid filler can restore the lost volume to the cheeks, temples, under eye area, etc. Other procedures that can help to treat Ozempic faces include radiofrequency and ultrasound-based treatments such as therapy or with the Morpheus 8. We can actually help tighten the lax skin. Another very important side effect that comes to us dermats is hair loss after taking these injections. Now, many patients on these medications notice significant hair shedding, usually 3 to 4 months after this major weight loss begins. This is very common and it's called telogen effluvia. It happens after you've had any major illness as well. So there's nothing new here. So any rapid weight loss is a physiological stressor on the body. In response, the hair follicles prematurely will enter the telogen phase, which is the shedding phase. Now, this results in a diffuse shedding that can seem alarming to patients. The reassuring news is that it is almost always temporary. And once the body adjusts and the nutritional intake does improve, this will stabilize and your hair regrowth will typically follow within the next few months. So weight loss injections are often seen purely as a tool for shedding those excess kilos, but their benefits go far beyond the scale. Clinical trials have actually shown that these medications significantly reduce the risk of cardiovascular events such as heart attacks and strokes. They don't just help with weight, they also improve your metabolic health, reduce inflammation, and even contribute to the stabilization and gradual reduction of the existing arterial plaques. In addition, if you're someone who have been dealing with PCOS, these treatments can be particularly impactful. It improves the insulin resistance and hormonal balance. They often help regulate the menstrual cycles as well, and hence enhance fertility outcomes. In simple terms, these injections don't just help patients look better, but actively protect their heart, support their hormonal health, and improve the overall long-term well-being of patients. So patients who are willing to better their nutrition habits, begin strength training, and work on long-term body composition, I think these injections are for you. So if you're considering these injections, please do it under proper medical supervision from a physician or an endocrinologist. And if you're already on them, don't neglect your protein and your strength training and even your regular check-ins with your doctor.